How would you briefly describe your project to someone unfamiliar with what you do?
It actually aims to work with community members and local partners to build a livable community that supports older adults to age in place with dignity. So we address food insecurity and social isolation. We currently work with a network of 20 local partners, and we have 400 active members, close to 400 active members in our village.
What is the why behind your project?
To give the voice and the choice for our older adults to create a community they would like to live in, because a lot of our seniors, they live in NYCHA developments, the public housing, and they're lower income, so it's actually really important to have the channel for them.
What has worked well for your project?
So our key partnership with senior centers has been working really well, and also our model to listen to our members and create programmings based on what they want.
What are some challenges your project faced?
One of the biggest challenges is definitely COVID. It impacted a lot of our activities. And the second, I would say, it's learning and understanding and leadership opportunities that would work for the community, and that's what the community would want.
How do you find appropriate partners/partner organizations?
We start with identifying key or one partners that we know are embedded in the community. We go to talk to them, we understand their network, and start from there to learn their advice and knowledge, and then reach out to more partners.
What funding sources have you utilized or will you utilize?
We're able to provide SNAP services to our clients, uh, utilizing throughout our SNAP program that's funded by OTUDA and Robin Hood Foundation. We also are able to provide health insurance enrollment services through a project funded by New York State Department of Health. And in addition to that, we also have some small funding opportunities. For example, we have a Get Connected pilot that provides technology support to our seniors, and that's through some private funding and fundraising.
How will this project be sustainable once your grant period is done?
We're actually able to, we're launching a new project that's called Harlem Health Advocacy Partner that's funded by the New York City Department of Health. Um, it's in the same target neighborhood, East Harlem, Central Harlem, and we will be able to work in transition to that project and continue the community work we have already built in East Harlem.
What stakeholders do you need buy-in from?
Definitely from the NYCHA developments. So it's the New York City Public Housing Authorities. They have a community engagement unit. They have their resident association leaders, and also other community partners, including senior centers, community centers. We also work with healthcare providers, so hospitals. So they're also really important.
What advice do you have for trying to replicate a similar project?
Definitely to start with talking to the community, understand what they want, and talking to organizations.
How do I get started?
A focused scope can have a big impact, and also some tangible resources that the community can utilize.
What do you wish you would have known prior to beginning the project?
At the beginning, we envision ourselves working with our community partners by building contracted relationships, exchanging referrals. But at the end, we realize what is actually working with community partners is just keep active conversations with them, have convening meetings with them, and learn from each other. And those are already really, really meaningful.